Today we're going to talk about the sheep dissection of the heart. Instruments that we're going to need: scalpel, forceps, hemostats, probe. It could be any variation of this. It could be a smaller forceps, maybe a second probe in this case that I might be needing to show you. Scissors, we can either go with big or small. So it all depends on your comfortability with using these specific instruments. You don't want to have your instruments in the dissection table or actually in the tray, because when you're doing this and you're moving everything around, your instruments are going to be in the way. If you have something that's sharp, you can always poke yourself, so you want to stay away from that. Heart. This is what we're going to use today. We have a sheep heart. The outside is a pericardium, and we must hold to determine whether what's going to be anterior or posterior. So before we get into that, let's go ahead and take off the pericardium. We're going to use our scissors, make a small incision, and then you can use your forceps or your probe to guide you through. In this case, I'm going to be using my probe, and that's going to align everything so that I can make sure that I can cut without cutting any tissues that are further below. So let's go ahead and do that. Now remove the pericardium. You cannot just yank it off, so don't do that. You must be careful because there are other vessels here, or the parts that we might be cutting off accidentally. So you want to make sure that you cut through those. So as close as possible. This is a pericardium. Do not confuse a pericardium with a layer of the heart. Okay? Some students do tend to confuse and think the pericardium is a layer. It's not. Your layers from the heart, and as we're seeing right now, it's a pericardium. This is on the outside. As we do the incisions, I will show you the myocardium and the endocardium. So now we look at the heart, and we want to go and have a ventral view and anterior view, first of all. So what do we have? We inspect the heart. What are we finding? We look for the left and the right coronary arteries, and we're just in general coronary arteries that we have. And if you follow this one right here, this usually gives you the division. This is going to follow the septum. Not this one back here, if you can tell. This one will give you your septum and will divide a left and a right. So we have right side of the heart, left side of the heart. If you want to place it on you, this is how you would place it on yourself. So you have right side, left side, right side, left side. Okay? So we would know this is the anterior view, and this would be posterior view of the heart. Some of your hearts might be a little bit different shaped. In the case of this one, it's a little pointier, so the apex is a lot pointier, maybe thinner, and that plays a big difference when you're trying to identify, as some will maybe be squished from shipping. That plays a big role. Just find whatever works for you, that it is in good shape, and that you can determine at least an anterior and posterior side. We can grab our tissues and get them out of the tray. As the next part, because not all hearts will be shipped the same, I'm going to remove some of the fat that we have on here, the excess fat that we don't need. We really want to focus on this section. But there are some blood vessels that if I'm able to clean them off, we'll be able to appreciate, and I can show them to you. You can see them on this video. You can tell this is a vessel here. And right now, once I clean it up, we'll be able to determine where it's coming from, and I can give you an appropriate name. Okay, so now we're going to talk about the right atrium and the right ventricle. So we're still looking at the anterior portion. This is the right side, this is the left side. What we have here is your vena cava. So this is going to be your vena cava. This is your atrium, this is your right atrium. In this case, our vessel is pretty small because we're not that close to it. And what I'm going to do is I'm going to cut open so I can put my finger in there. So let's go ahead and separate that section. In fact, I'm not going to just cut it off. Let's go ahead and dissect it like a little butterfly. So as I start opening up, my finger should be able to start fitting in there. This is the right atrium, this whole little section. That's the right atrium. You can put your finger in there. So when yours, go ahead and put your finger in there. Feel the right atrium. And you can follow through where it goes down into the right ventricle. And you can tell the space is going to be pretty small. If you compare it to the opposite side of the heart, the left side, and we look for an opening that reaches the left atrium, you can tell that the cavity is much, much bigger. So this chamber down here in the right ventricle is much bigger. So we find it. There's the atrium. So what I'm going to do now is I want to open up. Keep in mind, remember this is where the septum is going to run through. I want to open here, make an incision so I can open the flap this way. And that's what I'm going to do. And that's going to allow me to see the full ventricle, and I can follow through where the blood flow goes. So what I'm going to do is place a probe in here so it reaches to the bottom of the heart. It's closer to the apex. That tells me that I've reached the bottom portion of the ventricle. So now that my probe is in place, I'm going to position this for cutting comfortness, and I will follow through. Your probe is your guide to make sure you're not going anywhere you're not supposed to. So at the tip, you should be able to feel the probe. As you're going through, I still feel the probe. I continue going. As I start opening up, I see it. It continues. Keep going down until I reach the tip of the probe. This allows me to open up the heart in a butterfly format. So now let's go ahead and look at it. So when we closed it, we said that we were at the superior vena cava, or just the vena cava, goes into the atrium. There's the atrium. And if you want to further look into the atrium, you can cut that open. And this is what we're seeing. I'm waiting for the camera to focus. Okay. That's good focus. Now we can identify the parts. From the atrium, to get to the ventricle, we have to go through a specific valve. That valve is tricuspid. I teach my students that tricuspid is the first valve they're going to run into, and I tell them, try to remember the first one. So tricuspid. If I go to the bicuspid, I mention it as the second one, and I say, by the way, the second one is bicuspid, emphasizing on the bisection. So try to remember the first valve, which would be tricuspid. We have it here. This is the valve, And if I grab my probe, I should be able to see the flaps or move the flaps. Let's see if I can get this closer. Right there. That's the tricuspid. Okay. So in the next section that we need, the tricuspid are held by the chordate tendonae. So let's see if we can get a good focus view. Let's get it closer. There we go. These right here are the chordate tendonae. Remember, the tendons are attached to muscles. So there you have it. Okay. Now we can get the focus, see how further close we can get. In fact, go ahead and turn on the light, see if, now that I'm closer, I might, oh, there it is. Actually, the light, I don't need the light anymore. The chordate tendonae attached to the papillary muscles, right here. This is what we have. So these muscles in which it's attaching to is the papillary muscles. In fact, you somewhat see them throughout. These are the papillary muscles. Okay. You can also mention that as the tuberculae carnae, which is all this section in here. If we look at the layers of the heart, we have the pericardium, and you might be able to tell it's a very, very thin layer. Let's see, losing focus.
You want to try with the light?
Yeah, let's try with the light, see if we can see if it's able to get some focus. Maybe there. See if I can get it to focus through the tip of the probe. But this little edge, the little trim, that should be a good focus. Maybe here. The little itty bitty trim, that's the epicardium. Then we have the myocardium, which is the muscle, which is this that I'm scraping. And on the very inner wall, endocardium, endo for the inside. And you see that little color change right there. That's the endocardium right here. Myocardium and epicardium. Okay, 3 layers. The reason we want to dissect the heart this way is we go with the blood flow. So superior inferior vena cava goes into the right atrium, from the right atrium to the tricuspid valve into the right ventricle. Right ventricle, that needs to go through a pulmonary semilunar valve, and that pulmonary semilunar valve will lead us to the pulmonary trunk. From the pulmonary trunk, you have your pulmonary arteries. So here, what we're going to do is you find it. There's no other opening other than coming towards the back. If you really follow it, here's the septum. We talked about the septum being here in the middle. We follow it through the back, and you can put your finger through. Don't be afraid to push your finger through. Eventually, as my finger's in there, that's my finger right there, I know that that will lead me to the pulmonary trunk, which would be the pulmonary arteries. So what I want to do now is I want to continue and expose it. So now that I know where it is and I'm able to identify it, let's go ahead and separate that. So all I'm doing is removing this connective tissue. Yeah, it's a little too much light, right? It's going to reduce the light. So if you see, my finger comes out there. If I don't want to poke my finger, I can just use the probe. There's the probe, and it helps me separate some of this tissue. If I continue following it through, let's see where it leads. Let's try the probe following through where we had our finger. So we place our finger back in there. Let's see if we can find it. So remember, that's where I had my finger. I continue going. There it is. I have now connected the right ventricle all the way through the pulmonary trunk, which is the pulmonary artery, or the common pulmonary artery.
The trunk is just the bottom portion?
So I'm not going to cut this open yet because I don't want to destroy the rest of the tissue. Now we're going to focus on the left side. So if you think about it, we're done with the right. Now we're going to go with the left side. So we can remove the probe. We'll go back to it because we are going to open it up so we can see that valve that's in there as well. Let's go over to the left side. So with the left side, we know which one atrium, so now we can identify the atrium from the left side. That has to have an opening. So that's coming from your pulmonary veins. Okay? If you look at them, there they are. So we're going to go right into here. Okay? And we're going to do the same thing. You're able to put your finger, which we already did when we were trying to identify which cavities we could point out. So let's go and open that up. So we're going to go towards, remember you can always use the probe as a guide. And we're going to go open up towards the atrium. So now we can look in there. You should be able to appreciate some of the valves, which we already put our fingers through, but if we squeeze the heart a little bit, you can kind of see the way they close. Right in there. So what we do, same thing we did on this side, we want to go and find the apex, the lowest portion through the ventricle. So we're in, and let's go ahead and find it. So now I know that my probe is in there, and we'll reach the apex portion. I can actually touch it here, and that is where I want to do the cut. I don't want to cut right where the septum is because I want to see the effect of it. So I want to follow this portion of the coronary artery where you have the fat. Let's go ahead and cut that open. So once again, use the probe as a guide, and I can follow it through. You're going to notice how this ventricle will be much, much thicker. The left side, the wall will be much, much thicker because the muscle of the heart has to exercise a lot more to push the blood to the rest of the body. Keep in mind that the left ventricle is fighting off all the pressure from the arterial walls. Hence why you have arterial blood pressure. It is determined by the walls of the arteries. So this has to fight it off. If you compare, look how thin this is versus the right side versus the left side. And once again, now you have the valves. The valves on the left side, remember, bicuspid, because we're going to say, by the way, the second set of valves. So bicuspid, right here. Chordae tendineae, papillary muscles where they attach. So once we're at the left ventricle was going to shoot through the aortic pulmonary valve, aortic semilunar valve, and shoot to the aorta. Well, if I put my finger through, because it is the only opening, and this might be a little tricky for you guys, when you first see it, you say, well, where's the opening? I don't really see anything. Behind the valve. And see, can you see that in there?
Can I turn the light?
Yeah, actually, let's go and turn on the light, see what we have. See that in there? Right there. If I push through, it comes up to the top. That's the aorta. So what I want to know, or I want to show you, is the aortic semilunar valve, or the aortic valve. So now we have to find that. Now keep in mind that when we were working on this side, we saw some of these blood vessels, so we're going to try to stay away from those. If we have to, we can somewhat separate as best as we can. If not, we're going to end up going right through them. Okay? So this is what we have. We're going to continue through there. We're going to use a probe as a guide to make sure we're not cutting into anything else that we're not supposed to. We don't want to go past it. So now that's the first separation. And as we continue all the way to the top, let's see if we can separate this section. We were able to separate this section, so now we continue with the probe, follow through, all the way to the aorta. Now that the aorta is open, notice my probe is still in there, it's making a lot more sense. The aortic valves are right up here, right here. There they are. See these little flaps? That's it, aortic valves. Now in class we talked about coronary arteries, and I mentioned the coronary arteries as they came through here. And we talked about how do they get the irrigation? How does the rest of the heart get irrigation? Well, it's very simple. When blood is pumping through from the left ventricle and it goes into the aorta, the valves somewhat cover the little orifice of the coronary artery, the left and the right. Well, when the valves close, the blood flow that shoots backwards, that obviously cannot go return to the left side of the heart, stops at the valves because that's the purpose of them. Well, when it catches it, the blood's able to go into the coronary arteries, which are right here. So that's one of them. It's one. And here's the other. So the blood flow comes back down and it fills up. Okay, so now what we wanted to show you, now that we went ahead and opened this up, I can show you the pulmonary semilunar valve. Just to make sure we didn't destroy any other portion of it, we can come back to this. Let's go ahead and place our probe as a guide. And now we're going to finish cutting through here. So yes, we're going to cut a little bit through the atrium because that tissue is in front, but we want to follow the probe to ensure that we are going through the right portion of this dissection. When we open it up, there it is. Pulmonary semilunar valves, right there. If we look at the septum, now that we have done this cut, we can actually separate down the septum to continue having an anterior and a posterior portion of this. So let's go and do it. So let's continue our coronal cut then. Let's do and you now have your heart in two halves, anterior and posterior. There it is. Let's place it like this. Right side of the heart, thin side, right? And then the left side of the heart, much thicker chamber, or walls of the arteries of the left side. I mean, of the myocardium, sorry. There it is. Hope you enjoyed.